Dr. Brian Kroll, our guest on the morning show today. He is a family medicine doctor and grateful that he was able to join us in the studio today. First of all, Dr. Kroll, maybe you could talk about your role at the hospital and what you do on a daily basis.
Yeah, thanks for having me. My role, I'm a primary care doctor, so I see patients, what we call cradle to grave, so newborns to the time of life where folks transition to a better place, and I take that job very seriously and feel honored to be a part of people's lives for that long and really enjoy that part of my job. I also help with sports physicals. I help run a concussion clinic during for our athletes and anybody that suffers a concussion, and do some musculoskeletal ultrasound as part of this Orion project that has recently finished up in the last year.
I know that concussions are in the news quite a bit, especially with former NFL players. Our safety standards, have they improved a lot through the years?
Oh, definitely from my experience to now, it's been a huge improvement, understanding, and especially our sideline management, and that it really has all the effort from the athletic trainers. We're blessed at Richland Center and at Ithaca to have two excellent athletic trainers. Both Bree and Lindsay do just an incredible job. They can recognize concussion, get them in to us if needed, but manage a return to play protocol to keep them from having a second hit and a second concussion. And it's really good buy-in from coaching staff too. That's been the biggest transition. Just coaches want their athletes to be healthy first, and it's really awesome to see. You really want to protect athletes from themselves sometimes because they're tough and they want to get back on the field, but it's very, very gratifying and helpful to prevent them from worsening and getting back on the field actually sooner than they would have.
You bring up Bree and Lindsay, and I think them being in the building, they develop those relationships with the students, and there's a little trust there, and and maybe they obviously trust their opinion very much too.
Yeah, absolutely. I think they're a constant, and we're very fortunate to have them. Very well trained. They've got we have a good relationship at Richland Hospital with them, and have communication through text and through our electronic medical record. But they make my job very easy.
Why did you pursue this form of medicine and not go in a different direction?
Family medicine offers a unique blend of child care through geriatric care and everything in between, and so and you take care of every part of the body and mind, which is super interesting. There's never a dull day. You're learning constantly. And then you kind of can pick off your little niches that you enjoy doing most. And, sports medicine, being there for athletes, giving back to community through athletics and promoting an active lifestyle is super important to me. So being able to do that in Richland Center has been fantastic.
What about joint pain and arthritis and those kind of things? Pretty common, isn't it?
Yeah, very common. And I think when folks think about joint pain, they often think of osteoarthritis or some sort of arthritis that requires a joint replacement. And we have an excellent orthopedic group here that takes care of a lot of those patients. But there's a whole host of other etiologies or causes for this joint pain. And some of those could be autoimmune, or your body's kind of attack on itself, and not so much wear and tear. And that takes a different set of management besides replacing the joint. And so that's a particular interest, just because it takes a long time to get into rheumatology from the tertiary centers we have, both Gunderson and Madison. And so being able to provide a service here to address some of those issues for rheumatologic causes of joint pain has been very gratifying.
Some people will talk about the weather changing. Does that have an effect on joint pain?
Anecdotally, yes, absolutely. I think anybody who has arthritis can tell you, and maybe you can hire one of them for your weather portion.
We need to.
Yeah, have an inside scoop.
Because they can tell when the storm's coming or whatever. So.
Absolutely. I mean, I think there's definitely something to it with pressure changes, and when you have joint damage, the physics inside your joint is different, and so you feel that pressure a little bit other than folks that have a healthy joint.
Seasonally, I mean, this time of year maybe, but I know we talk about the winter time, and that seems like it's hard on everybody, right?
Yeah. I mean, I think when you hurt, you don't want to move. And the paradox is with arthritis, moving helps. You just don't want to move too much or be pounding the joints too much. So if you're going for exercise, going on a bike ride or uphill walking versus a jog would be better. And so in the wintertime, people don't move as much and it's colder, so they don't want to move as much, and then they tend to be in more pain. Usually then the summertime comes and they're a little bit less strong, and when your muscles decondition, you struggle to get back to the activity that you're used to, and that also produces more pain. So it kind of becomes a vicious cycle in Wisconsin. I often talk to my patients about trying to just maintain in the winter. You don't have to do anything crazy or special, but just don't decline, because one of these times you won't be able to do what you want to do in the spring, and then you get frustrated, come to the doctor, and we work with you to help, but it's a lot harder than just maintaining in the winter and avoiding that slump.
Yeah, that brings up an interesting point. When I was having hip issues, it wasn't the hip that was sore, it was the muscles around it.
Right.
You know?
Yeah, preserving strength is so key for everybody's well-being. By age 30, you start losing muscle mass, and so if you're not fighting against it, it's you're losing the battle. And so any sort of resistance training beyond walking, but doing squats or lunges, any sort of resistance training to strengthen your quads and hamstrings and glutes will help the bigger joints, especially hips, knees, ankles.
Transitioning from us older people to the younger people, you know, the $1 million question lots of times is athletes specializing in one sport. And, you know, there's a lot of discussion about whether it's volleyball or basketball that you play year round, you use the same muscles, and that jarring effect. Maybe you could talk about that a little bit in the effort that athletes have. Maybe you need to do some other things once in a while, don't you?
Yeah, I mean, this is a can of worms, but I think there's really good data now on over-specialization and the negative effects it has for an athlete. And, you know, a lot of times it's a complex decision because parents just want to provide the best opportunities for their kids. I've got a 2-year-old right now, so I'm not in the thick of travel baseball and travel sports. But I can't imagine that the crux of the situation where the opportunity to play and travel ball is maybe your only opportunity. All your friends are doing it. So how do you be the parent to say no? Hey, maybe we should try other sports during these seasons. Especially if the ultimate goal is to go to the next level. Over specialization too early often leads to burnout. They stop having fun. Chronic injuries, and they stop becoming an athlete. And when you look around at any professional sport or any college athlete, they're athletes. You drop them into any sport, and they can probably participate and be upper level. And so, specialization, once you get into high school and you're considering going into college, and you made that choice, you know, even into your sophomore, junior year, I think it's reasonable to spend a little bit more time. But any sport is training. It's kind of cross training for a different sport. It's important to stay active. It's important to like what you do, and if you do that, you're going to go a long way.
Especially the younger grades. And I mean, you played football at the next level too, but I think by the time you're a sophomore, you know, you're people kind of know where you're headed, you know. I mean, maybe that's the time you specialize. Before that, you know.
Yeah, I mean, I think puberty is a giant differentiator. sometimes talk to young kids about this is, you're taking performance enhancing drugs when you're in puberty because you for the first time are experiencing hormones that are promoting muscle growth, and that you see that in sports at young kids. The kid that's gone through puberty is dominating because they have performance enhancing drugs on board with natural testosterone, and the other kids haven't had that happen to them yet. So I don't think you can really judge somebody's true potential until they've gone through puberty. And playing all sports, you're developing hand-eye coordination, lateral strength, movement flexibility, being able to fail and overcome, and all these are just lessons that is necessary versus over specializing and being told you have to do it in this way, and then you lose the fun.
Mm-hmm. That's the number one thing. That's why they quit sports lots of times, isn't it?
Yeah.
As far as aches and pains, when should we come see you, and when should we just kind of blow it off like, oh, this is just aging?
Yeah. I think that's a common question, and I mean, I think it's important to I think have a good relationship with your primary care doctor. An opportunity once a year to see them for just your general health maintenance, looking in, making sure that you stay healthy from things that maybe you can't control, age-appropriate cancer screenings, making sure that your cholesterol and metabolism is fine, talking about all these preventative services that most insurances cover at no cost to you. It's also an opportunity then to have a conversation with your physician about, hey, now I've been meaning to ask, I just haven't had the time to come in. I've had these aches and pains. Sometimes they're more serious than others. Rheumatoid arthritis usually starts between the third and fifth decade of life, so 30 to 50. And once you have joint damage, it can be permanent. And so it's a younger population versus osteoarthritis, which is generally older. And so, especially if you have aches and pains that are more atypical, or you don't even know if it's typical or not, I think that's the job of the doctor. And, fortunately, all the providers at Richland Hospital were obtained this training through the Orion program to have better access and teasing out, is this something that is a rheumatoid or autoimmune cause, or is this something that can be watched and other forms of treatment and be offered to improve those symptoms. So just having a good established relationship with a primary care doctor often can prevent these things, because it's just an opportunity for you to talk about what's ailing you. And I know that every one of the providers at Richland Hospital are well trained in that matter.
What about over-the-counter pain relievers? Because they help.
Yep.
But how much is too much, right?
Yeah, that's a great question. And there's kind of two categories of over-the-counter pain medicines. One is a broad category called NSAIDs, non-steroidal anti-inflammatories, and those are the ibuprofens or Advil, naproxen or Aleve, Motrin. All these are what you generally reach for when you have an ache and pain. They work really well. They help with arthritis and decreasing the inflammation, which is what causes pain. But if you take them every day for more than a week, generally you start causing some problems. They will kind of hurt the kidneys and could cause permanent kidney damage. It can raise your blood pressure. They can also cause a GI ulcer and bleeding in the belly. And so they work really well, and sometimes we're not able to use them because of those risk factors, or you've had a heart attack and you're on a blood thinner. But Tylenol is something that can be kind of taken with that guilt-free up to about 4,000 milligrams in a day. And that's probably staggering to most people, thinking, oh, I'm going to take 4,000 milligrams, but that's safe to take even with somebody that has liver disease, 3,000 milligrams is okay. But that's a safe medicine to take. Heat, movement, lidocaine patches. There's all these topicals that can help. But I think getting moving is pretty critical too. I've had a lot of patients come in with pain, and telling them they have to move is always a surprise because they're in pain and they don't want to move. But that's a way to break the cycle, because getting stiff often makes it harder to move than just continuing to move.
Do you utilize ultrasounds?
Yeah, so part of that Orion program, they set up some training for me to do musculoskeletal ultrasound, and I spent about 9 days down at University of Wisconsin learning this, and then several hours after went down to Florida earlier this year and spent 3 days at a conference learning musculoskeletal ultrasound. And it's a diagnostic tool to look into the joint that's not an x-ray. There's no radiation. I can do it right in the office, and most people think ultrasound, it's like, oh, it's a OB tool. I'm looking at the baby's heart, or maybe you've had a blood clot or an echocardiogram. It's the same technology. It's just looking at the joint itself, and the utility of it is you can, for some orthopedic conditions, even just run-of-the-mill osteoarthritis, if you're looking to put a needle in a joint to do an injection, you can actually see the needle go into the joint, and so it's precision from those simple procedures that you can do without it, but it just offers an extra form of precision, along with diagnosis for some of these autoimmune conditions that are tricky to diagnose. Oftentimes the labs and blood work you do don't tell the whole story, and when you can see the joint, and if there's inflammation in the joint or evidence of certain signs in the joint, you can diagnose it without lab work. And so having that here and connections with UW, I still talk with the folks that train me. It helps kind of speed up the process of referral if needed, and diagnosis and getting on early treatment, because most of the starting treatment we can prescribe here at Richland Hospital. And so it's been a very gratifying way to kind of jump the line, so to speak, in the rheumatology referral. I see my own patients for this, as well as other providers who want me to see their patients. And if you're interested, you can call Richland Hospital and ask for Dr. Kroll's musculoskeletal clinic, or talk to your provider about it.
That's interesting, because now us as patients, we can utilize telehealth, but you as a physician, you can kind of have that communication by video as well, can't you?
Yeah, absolutely. I think video visits are a great way to expand, and offer a different service line to patients that can't come in, whether it's car trouble, it's too hot, it's too cold, it's hailing out, and a lot of work can be done through video.
You are joining the staff officially for the Richland Center football team, right? You helped last year, didn't you?
Yeah. So me and Jay were both the defensive back coach last year, and Coach Troxel has been a joy to work with, along with the rest of the coaching staff, and it's been a lot of fun. I've helped with some of the weightlifting this winter. They've got a great program there that they offer for any high school athlete, not just football players. So I always encourage my athletes and students who've never lifted weights to try to attend one of these programs, because it's a free service that you get excellent training and education on, because once you leave, that becomes very expensive to get a personal trainer. And once you leave high school, you kind of lose the ability to just show up and have someone walk you through how to perform these, and it's a lifelong skill that's so critical to preserve your health and wellness as you get older. So I encourage any high schooler to really take advantage of that opportunity that is offered by Coach Troxel and some of the strength staff.
It helps you with, regardless of what sport you're out for, doesn't it?
Life. It
Life.
helps you with
Yeah.
life.
Right.
Life's a sport. I talk to a lot of my blue-collar workers, farmers, factory workers. They're a professional athlete, and in some sense, they require their body to be working and pain-free and strong to perform their job. And, you have to kind of prepare your body for that, for the long haul. And if you don't, then that's when injuries can come in, and when you're relying on that for your livelihood, it can be pretty disconcerting when you have to take 6 weeks off to recover from an overuse injury, or arthritis now is creeping its ugly head, and some of that could have been prevented.
I was surprised to see, I looked it up not too long ago, about the number one sport in terms of concussions, and football isn't number one.
What's number one?
Well, I believe it was soccer, from the headers, and then I think wrestling was another one.
Interesting. Yeah, I looked this up recently too, and I had football one, but in women's sports it was soccer, and then wrestling and soccer were very similar. But I mean, yeah, concussions beyond football are prevalent, and recognizing that from a patient standpoint, from a parent standpoint, and getting them in. Go to the athletic trainer, talk to the coaching staff, talk to your primary care provider, and we can get them in. Ask if you're going to urgent care, ask about the concussion clinic. We try to prioritize our athletes to get them and work with the athletic trainers, because it's hard to manage all of that with school and restrictions from an urgent care. It really comes better from a primary care perspective.
Obviously, your student is going out for football at Richland Center. They should feel safe. You got a physician on the sidelines. You got Bree or Lindsay or whomever. I mean, you've got good care right there, don't you?
Yeah. I mean, football has so much to offer. It's I think a way to build mental toughness along with physical toughness, camaraderie, teamwork, and I think a lot of sports check those boxes. I'd encourage parents to consider sports as a second part of school. Trying to get at least one sport in, whether that's golf, volleyball, soccer, football, baseball. It doesn't have to be football, but encourage all parents to push their kids to pick up one sport, or you have to pick one sport just to learn those skills.
Why do you like the community? What do you love about going to work at the Richland Hospital?
I mean, it's everybody has a common goal. We all live in the area. We all chose this area because we have common interests in wanting to practice great medicine for a population of kids to older adults that need it. And giving back to the community, I think, is a big part of all of our ethos there at the Richland Hospital, whether it's through coaching football or coaching the basketball team, or being part of their church and leading Boy Scout troops, or something along those lines. We all have interest in just bettering the community. We want our patients to live up to their potential and their goals, and be right alongside them.
In a small town, more so than the big town, but you get to know a lot more people probably, and coaching, you make those connections as well, right?
Oh yeah, it's been you sit down it's a long journey going from undergraduate through medical training. You often write multiple personal statements on why you want to get into it, and why you want to go to a certain residency, and I've had numerous moments where those essays have come to fruition in our community, and having a solid why of what you're doing and seeing that come to fruition is pretty remarkable, and I feel very fortunate and lucky to be in my professional situation here.
Practices will be starting soon. Another reminder is to get those physicals taken care of, right?
Yeah, WIA sports physicals, you need them every 2 years. Getting them done in the summertime, usually it's a lot less busy now compared to August, just with school starting and needing to get the fall sports done. So $15. It's a quick appointment. You have to bring the WAA form and have a parent present. Those are the only restrictions. All providers are doing these, but you don't have to see your provider. You can see anybody, especially if a certain date works better for you. But get them done early. It's a necessary and important part of clearing your child for athletics, and it's a requirement. So every 2 years you need it.
And they go to the school and get the form, right?
You can print it online.
Oh, you can?
Yep, you can find it online. You can go to Richland Hospital's website. There's a link on there. If you just Google Richland Hospital WIA form or Google WIA form, try to bring it in. If you forget it, we'll have one for you. It's just there's a lot of questions on there, screening questions that streamline the visit. If you're on a time crunch, bringing it ahead of time is important.
Great. Always good to have you in the studio.
Yeah, thanks for having me. I really appreciate it.
We'll probably see you on the sidelines real soon.
Yeah, I can't wait.
It's coming. Dr. Brian Kroll joining us from the Richland Hospital on this portion of the morning show.